too.
Nice to meet you too. A few months ago.
Okay.
I lost quite a bit of weight, so even though I hadn't gained it all the way back, I see that there's areas that are thinner than they used to be, so that might get improved. But for a long time, I've not been happy with the lower part of my face.
Okay, got it.
So that's an area of concern for me, and then just, you know, this area of my face.
Okay. I'm going to take a look at the pictures up there, okay, if you don't mind.
No, feel free.
So one of the things that I notice, Joanne, when I look at this, is that there's a lot of laxity in the neck.
Oh, yes.
So you can see there's, you know, just the skin is loose here.
Right.
And there's some waviness there and some laxity here.
Mm-hmm.
So I'm going to go to the front photo. So when I look at your face, you know, I see a very pretty woman. What you want to have is an inverted triangle.
Mm-hmm.
So as we get older, we get more square. So our face gets more square because this starts to drop. And so we start to get a square look. And what we really want is an inverted triangle because we really want to be able to see the eyes.
Right.
We want the eyes to be the center of our focus. And also what happens as we get older, people start not only to look at the eyes, but start to go back and forth between the eyes and the neck. So this all looks really good. You actually have good volume here. Some people are kind of, they're more hollow here. You have great volume here. Really pretty volume in your cheeks. You have beautiful cheekbones. You have nice, you know, your eyebrow position is really good. You know, you have a little bit of skin here that could be cleaned up. That would be very simple, just to make your eyes pop a little bit more.
Right.
But your eyes are really pretty. They're beautiful. In here, we have a couple of choices. To deal with the neck and the jowls, you know, we probably need to kind of tighten the skin, get rid of the excess skin. And we can also volumize in here, either using something like Sculpture or your own fat, just to give you some more volume here. But that wouldn't be my first thought. My first thought is to really just clean up this area. And we can kind of look at it just together, and I can show you. What I would do with you, and this is the way I like to do my incision, I like to go right in the hairline, right in here. It's like almost like a little U. And then I come down here right behind this little piece of the ear called the tragus, right here. And I come right in this crease, and then I go behind the ear, and the back of the ear, and then I go into the hairline.
Okay.
And with you, I wouldn't make an incision under here. And so when we tighten everything, we're tightening from here over, so I'm going to be pulling like this. So we won't be going anywhere near that scar. We don't come here because we lose the sideburns. We come here, we go behind here, go down here, go behind the ear, and up into the hairline. So it's really hard to see.
You can barely even see it.
You can barely see it. That's the beauty of it. Now, with Tony, I made an incision under here as well, and that's really hard to see too. But you don't need that because you don't have a lot of fat and a lot of extra stuff. What we just need to do with you is just really, again, just tighten this like that, and that would look really good. And just like this.
And then beautiful skin.
Yeah, she's really pretty. And then we talked a little bit about putting a filler in here just to kind of get rid of this downturn right here that we get. It's a very common thing. We start to get that in our 40s, so that's an early thing. Yeah. So I just wanted to show you the incisions because we like to show how like it looks very natural. And then some doctors will go in front of the ear here, and it doesn't look good because you can see it. So the idea is to try to camouflage as much as we can, so you get a really natural look that no one knows except your hairdresser.
Right.
That's the idea. It looks like you went on vacation, you know, did you do something relaxing, and that, you know, that you don't look surgery.
I have never actually taken the first step to do this, but I know it's coming, so this is a good time.
Yeah, it's, you know, it's a very similar process. Every doctor has their own way of doing it, but what I like to do is I like to tighten the muscle, I like to hide the incisions, and I like it to look as natural as possible. And the incision placement is really important because it looks more natural when you do the incisions in a way that you don't remove too much hair and things like that. Once you start losing and moving hairlines back, then it doesn't look good, because when you go swimming and you get out of the pool and your hairline's here, it doesn't look good.
Right.
You know, it's a telltale sign. You want to avoid the telltale signs.